Good afternoon, everyone. Thank you for participating and joining us in the rebroadcast of The Color of Vaccine Part 2. We hope you enjoyed it, and we're going to go ahead and start with The Color of Vaccine Part 2 right away. We do appreciate you all for waiting patiently as we begin the second part of this production. And I'm going to go ahead and bring on my esteemed panelists. Let me go ahead and add them in with us today. Hi, everyone. How are you?
Okay, and yourself?
Oh, absolutely. Thank you all for joining us today. My name is Dion McNeal. I am the director, but I also go by Dusty Lion. And within Hopeful and Victory Talks, where I have a conversation in regards to destigmatizing HIV. But today we're going to be having a discussion about the Color of Vaccine Part 1, in this particular production, the Color of Vaccine Part 2. I would like to go ahead and introduce you all to the mother of health, who's been guiding the efforts here in the state of Illinois in regards to vaccine hesitancy, our approach to the COVID-19 pandemic. Yours truly, Dr. Ngozi Ezike. I'd like to go ahead and introduce our panelists here today, along with Dr. Ngozi Ezike. Let me go ahead and begin with the man himself, June Chappelle. June is a native of Chicago South Side who moved to Springfield in his late teens along with his family. June has had a lifelong interest in Africana history, and genealogy, stemming from family stories told to him by his father and various elders about his Creole and Gula Geechee heritage. He volunteered to work on. Oh wait, I'm sorry.
Sorry, it's Gullah Geechee.
Gullah Geechee. Thank you for correcting me, June. Gullah Geechee heritage. He volunteers and serves on the board of the Springfield and Central Illinois African American History Museum, where he had done work as a docent, archivist, and historical researcher since March of 2018. June has served on the Sangamon Experience Advisory Board, assistant to the executive director of the Garvey Tubman Arts and Research Center, and then also the Sangamon County Historical Society and the Illinois History Collaborative. He pursued a bachelor's degree in Africana Studies at Allen University, which you probably heard within the documentary of Part 1, and that's in Columbia, South Carolina. He pursued a bachelor's in sociology and minored in vocal performance. Until recently, he has had on the staff of the Illinois State Museum as a historical researcher specializing in African American history and archives. He is the first African American to hold a position in their history/decorative arts department. The museum was established in 1877. June is also a published freelance journalist with the Illinois Times. In his spare time, he enjoys sketching, reading, and spending time with close families and friends. Thank you for joining us tonight, June.
Thank you.
And then I'd like to go ahead and introduce the lovely and the magnificent Dr. Leslie McKnight. Dr. Leslie McKnight is the director of the Community Health Policy and Planning at the Peoria City County Health Department. She is responsible for the development and implementation of the partnerships for a healthy community health improvement plan and health promotions and equity interventions throughout the Tri-County region. All right, come on, Dr. McKnight. Dr. McKnight has over 20 years of experience in the public policy and community development for local government agencies and has managed millions of dollars in grassroots and public-private partnership programs and activities, related to housing, community, health, and economic development in Central Illinois. She holds a PhD in organization development from Benedictine University in Springfield, Illinois, and a Master's of Science degree in Human Services Administration from Spartus College in Chicago. She is published in many academic and leadership journals and is an adjunct professor and the Master's of Business Administration program at Bradley University. Her research interests include organization strategy, adaptive leadership, and change management. Dr. McKnight's most recent article, Building Healthy Communities, was recently featured in Peoria magazines. Thank you for joining us tonight, Dr. McKnight.
Thank you, Dion, and thank you, production team, for this opportunity. It is an honor.
Absolutely. And I'd also like to go to our very special panelists as well, Claron Sharif. Claron, thank you for joining us tonight. Claron is an administrative admissions assistant, actor, writer, producer, and owner and founder of Snapdragon 40 Productions, and a mother. So if you have some time, go ahead and check out Snapdragon 40 Productions. How are you doing tonight, Claron?
I'm well, thank you. How are you?
I'm doing good. Thank you for asking. And then finally, Dr. Ngozi Ezike. Thank you for joining us tonight, Dr. Ngozi Ezike.
I think we got it working now. Thank you so much. Of course, unexpected challenges, but after this year, what's unexpected?
Absolutely. We try to move forward and try to figure out what's the best solution and keep that best foot forward. So thank you for really being here with us and sharing some of your time with us as well. Dr. Ngozi Ezike is the director of the Illinois Department of Public Health, also known as IDPH, the first Black woman appointed to lead the 143-year-old state agency. During her tenure with IDPH, she has gained recognition as she leads the state through the COVID-19 pandemic, providing televised daily updates and guidance for Illinois residents, and collaborating with businesses, community organizations, and healthcare institutions. Under her leadership, Illinois has successfully vaccinated more than 70% of its population, developed rapid response, in-school COVID-19 testing protocols, and established a voluntary ambassador program composed of more than 1,000 state residents who take the messages of COVID-19 awareness and good health to their respective communities. A graduate of Harvard University and the University of California, San Diego School of Medicine, she is a diplomat of both the American Board of Internal Medicine and American Board of Pediatrics. She is also an assistant professor of pediatrics at Rush Medical College and the recipient of numerous awards, including honorary doctorates from Southern Illinois University and Knox College, and the University of St. Francis Sister Clare of Assisi Awards. Thank you again for joining us, Dr. Ezike.
Such a pleasure to be with you all.
So if you will, can you go ahead and share with us a little bit about your involvement, provide us some insight in regards to the COVID-19 vaccine?
Well, I think everyone understands where we are. We started off with this new virus that we didn't know anything about, didn't really have any tools to fight against it. We were learning as we were getting infected and watching loved ones get sick, go into the hospital and worse. Then we started masking and really just trying to stay away from everyone to limit the spread. Then finally, in December, the vaccine came out, and it seemed like everyone was very happy that this vaccine finally came out. It came out, quickly, faster than people are used to seeing vaccines come out because of the huge multinational collaboration and the infusion of a lot of money on the part of the U.S. government to support the efforts. So we started vaccinating people, and we've seen so clearly that people who get vaccinated, are protected from this deadly virus. So we've continued to vaccinate. We've vaccinated about 7 million people just in the state of Illinois. And so now where we are is that we're in this pandemic of the unvaccinated, where the people who are getting admitted, and there are 230 people every day just in the state of Illinois going into the hospital. Those people are almost 90-something% unvaccinated. And so we're at this crossroads where we have this life-saving resource that can save lives, can prevent people from dying from COVID, but because of centuries and lifetimes of mistrust combined with tons of misinformation, there are people who are not willing to take this vaccine. And so that's where we are now, trying to help figure out how we can bridge that divide to get people to a place where they can utilize a resource that will literally save their life.
Hmm. Absolutely. And I'm glad you had mentioned that we're wanting to build this bridge of bringing in us upholding and upheld public health in the interest of everyone within the world, so that we can get out of this pandemic better. And I would like to present this question to the panel here as well. We all come from various backgrounds and various experiences, right? So my question I would like to ask you is, we witness people around the world devastated by the COVID-19 virus. However, people still believe that the vaccine is part of something far greater than what the messaging is out there today. How might disinformation contribute to vaccine hesitancy? And how, in your community, have you engaged with that to try to clarify and provide education for individuals who may be leading with misinformation?
Well, I can go first. As the Director of Community Health at the Peoria City County Health Department, we've actually been in partnership with Dr. Ezike's office in providing community clinics. At first we were centralized, and we had key locations, our health systems, and then we had our off-site location. But now we're doing pop-ups. Basically where everyone is at. It can be grocery stores, parking lots, it could be special events and activities, it could be social service agencies. And so we're using this as an opportunity to actually partner with our health systems to bring in the physicians out of their offices, bring them into the community, and as part of having the vaccines available, having those community conversations on addressing any concerns, any hesitancies, dealing with the mistrust and the medical mistrust, particularly in communities of colors. And it has been working. I mean, having that residential engagement is paramount, because in communities of color, a lot of times information is shared via word of mouth. And that's part of our, historic culture. So if we can build up our neighborhood champions and the elders and, get them to be our ambassadors, it goes a long way. And when we've actually have moved the needle, I'm excited to report in Peoria County, African Americans, we make up 18% of the population. We started out when vaccines was first released, we have 4% of our population vaccinated. Then the needle moved to 7%. And just last week, we got reports from Dr. Ezike's office that we have moved the needle to 11% of that population is now vaccinated. So we are overcoming this hesitancy. Again, it's all hands on deck. It's not just the health department's responsibility or the state. It is everybody's responsibility that believes in the vaccine, have done their research, the medical factual research, have had that lived experience, can do storytelling about those and their family members that are impacted by COVID. And it's going to take us all, and it's the tagline from Dr. Ezike's office: let's end this pandemic together. So I'm actually very hopeful, because it is a war, but we are fighting this war and we're making ends to it.
Thank you so much. Oh, go ahead.
Go ahead, Dr. Ngozi.
Oh, thank you so much, Dr. McNeal, just for your optimism and also just, sharing that, hope is not lost. We have reasons to be hopeful. And I know you're on the front lines making that happen. So thank you so much. I really would like to think about, what do you think? We obviously care about the health of our community. We care about the health of our people. And with respect to African Americans and other people of color, is it dealing with mistrust and the right messaging? How to make sure that we're not crossing the line over to coercion? How do you think about that when we're trying to do the right thing for our people and just really trying to throw the kitchen sink, trying to get people to do what we think is the right thing to save lives? I'll put that out to anyone.
Yeah. Well, Dr. Ezike, Director Ezeke, thank you so much, for the opportunity, and Dion and the honored guests too. One of the things that, I think is that we have to start thinking about all the geopolitical situations we're in and how people are losing jobs. They're, trying to save their family. They're losing family members. And that gets compounded on top of the social determinants of health we always talk about. The poverty, structural issues about racism and those things that are in the background. So I don't think it's a very simple answer. I think it's very complex. And we have a tendency to try to make things, come out of the gray zone and either go black or white, right? That we can understand the difference between those two. So I think people are being hit with a lot of complex concepts. And sometimes I wonder whether it's really a failure of, in essence, of our educational system, in that people have not been educated the right way to think about science, about technology. We sort of accept a cell phone, but we won't accept a vaccine. And we accept that, the technological advancements that we think are important to us every day, but we don't really understand how that impacts our health. And I know you and the department have been doing a lot reaching out to people. Actually, I think we've had a very successful time period with the outreach you've been doing in comparison to people who don't even take the seasonal flu vaccination. So we're actually past that point right now of where people were. And I think people are just trying to react out of their emotions more so than just logic and thinking. It's really just a response to all the things they're hearing, the media stories that sometimes are very contrary or conflicting, and people just don't understand. So we have to really make a concerted effort to get people vaccinated. I've been hearing too many stories about people dying. I have people, even my own family, who won't get vaccinated, right? And I sit there and just hear the stories, and they're taking the opinions of people who have no real background in health, and just start sort of armchair quarterbacking everything and saying this is what you should do. And so it's really scary to me. I think it's a time period where people have to be reached, in their hearts, and we have to address the emotional issues and why people are reacting the way they are.
Absolutely, well said, Dr. Arnold. And I know if you have seen the documentary Part One, you can see within that production that I'm gonna bring the spotlight to you, Claron. But Claron has shared with us that she is choosing not to take the vaccine, particularly for her personal reasons. And I kind of want to ask you, Claron, in this particular question itself. What kind of messaging and information would you like to see coming from your local public health agencies, and kind of helping to improve or even just really demystify some of the misinformation that's out there? What are some tools and practices that you turn to that really help you get to where you're at? Whether it's, I'm not going to take the vaccine, but I'm still going to practice these measures to make sure that I'm protecting myself and I'm protecting my family as well as my community?
I have to be honest, after watching the documentary and listening to Dr. McKnight and Dr. Arnold, and tonight, Dr. Ngozi, am I saying that right? You've actually helped me lean a little closer to considering getting vaccinated. So I'm feeling a little bit better, to be honest. And I thank you all for your insight. So I'm not quite there, but I'm getting a little closer. I'm feeling a little better, knowing the things that they've talked about, the science of it, your little model of the virus itself, that helped me a lot too. So I'm feeling a little bit better.
Good news.
Well, I love that model within the video where you see the inside the blood vessels, and as Dr. Arnold is talking about the variants and how they look, you see like the different color protein spikes that's on the virus, and you can see how they look different. And I was like, oh, like when me and Don were editing this in the studio, I'm like, oh my goodness, this is it. Like this is the visual piece that can really help really demystify some of the information that's out there. So maybe some preconceived ideas and opinions, but it's just that visual element of just this is how it looks, and when we're really looking at it at a very micro level, beyond the information, beyond the headlines. This is what this virus looks like, and this is how it's attacking your body. So I applaud you for mentioning that piece there.
And real quick, Dion, if you don't mind, I think one of my biggest fears outside of the mistrust is the side effects. I'm a little terrified of, am I going to get real sick? That's one of the reasons I didn't get the flu vaccine, because I'm like, how sick am I going to get? Am I going to be near death? That scares me, really.
Yeah. And one thing about that too is that, I have my wife was walking on a path, just doing her regular walk. She likes to do, these walks, and she ran across one of her friends, and her friend was a triathlete, really avid triathlete. Just, every morning she got up and exercised. She's a vegetarian. And she said, well, how are you doing? And she said, well, not too well. And she said, why is that? And she said, I'm a vegetarian. I do everything. I'm real healthy. And 7 months ago, I was offered the vaccine. And I decided I'm too healthy. Why do I need to take this vaccine? And she turned it down. And she said, 2 months later, I found out that was the wrong decision. I ended up getting COVID-19. I was hospitalized. I was on a ventilator for 3 weeks. And when I came off, the doctors told me I had a ground glass appearance. It's like broken glass. That's how the chest X-ray film looks. And she said I had extensive scarring in my lungs. And she said, now as a triathlete, I'm trying to figure out whether I can walk around this track once. And she said, it changed my entire life. I'm no longer a triathlete. And she said, what a mistake I made, because now my whole life has changed. I had to deal with the mental health repercussions of my decision. And it's going to change the course of my entire life. It may have shortened my lifespan. And we know, and Dr. Ezeke's been talking about this over and over again, people have had lung transplants, double lung transplants because of this. And the Mayo Clinic is talking about how this affects the heart, is potentially linked to Alzheimer's disease progression. It affects the brain, it affects the kidneys, it affects the lungs, and this is something that if we can avoid getting sick from this, we've got to make that effort to do it.
I'm glad you mentioned. Oh, I'm glad you mentioned that, Dr. Arnold. In terms of the historical factors and how some of that is it can play out in real time, right? Some of those scenarios where people are not really trusting it, but as you explained with your situation or your scenario with your wife, that happens. And when you mentioned that, like a light bulb went on my head. Like I remember the clip where June had mentioned, the part was like, I shouldn't be shocked, but also happy that I'm seeing a health provider that is a person of color, because like a little bit in me just feels safe. It knows that I'm going to be taken care of. And I really want to pitch this to you, June. This question: do you think we need to have more complex conversations about, trust rooted in Black institutions, specifically centering, Black healthcare professionals?
Well, would you mind reiterating? I'm sorry, you were breaking up. Sorry.
Yeah, absolutely. I was asking, do you think that we need to have more I wouldn't say more complex, but more conversations about trust rooted in Black institution that's centering, Black medical professionals that are entering in that area, since we've seen in historical factors that care and that provider was not always that person of color. Oh, I think you're muted. Happens to the best of us.
Sorry, but yeah, I think it's very important to like have those conversations. Like I mentioned in part one. I mean, from a personal perspective, like it's very rare that I've actually come in contact with very many like Black healthcare professionals throughout my life. I'm nearing my 30s, and that kind of says a lot. Oh, sorry. Oh, but sorry, I'm a little nervous. Sorry about that.
You're fine. And if anyone would like to add on to that, please feel free to jump in.
Well, I would like to add on to that. There would definitely, it would be advantageous for us to have more Black medical practitioners. And I can tell you about my personal experience, just working at the health department, but also, being out in the community trying to address COVID and, educate the community and promote the vaccines. What's been happening is many people of color, they'll come up to me and they want to have these private conversations. And when we have these conversations, they'll reveal to me about, they may have cancer, they may be autoimmune, they may have had some issues with pregnancy. And they tell me that, the doctors don't listen to them. With their issues of pain, they want to be part of the treatment plan, and the doctors just kind of glaze over it or don't, really explain to them what's going on. And then they start, actually trying to ask me a lot of questions because, they're debating whether they're going to get the shot or not. And I'm not equipped to respond to those questions, but I'm a person of color. I'm someone that they trust. So, what it has exposed is the level of literacy, health literacy, and it also has exposed the relationships, between people of color and their medical practitioners. And many people we talk to, haven't been to the doctor in years or even have never had a shot because they're scared of needles. So, there is a huge gap in our, medical institutions. And I think that there now is emergence starting to realize that as we start addressing equity and the social determinants of health. And, our medical systems are like, okay, they're now at the table saying, what can we do? How can we do more? And so this is our opportunity to continue to have these types of community conversations and to inform them that, it's going to take you to go a little bit deeper in regards to, being culturally aware, in regards to actual health education and asking those overall questions about, their built environment, their level of pain management, their diet, nutrition. So it is opportunities. And, if we do, produce more people of color in the medical industry. That is paramount. So we need to do some investments and start targeting resources, for a career path as well.
Yeah. I mean, that's so absolutely true. Well, Dr. Ezike.
No, there was so much in there, Dr. McKnight. I mean, I think we have to remember that, I know for Black women, they make up less than 2% of all the doctors that are out there. So if every Black woman was hoping to have a Black female doctor, there just aren't enough. So I really, there are conversations upon conversations that need to happen. We absolutely need more representation in the medical field. But given the situation that we have now, and as we think of, the situation today and the lack of, the dearth of people who need to get the vaccine to get it, how do we break down those conversations? Like, what's the conversation? What's the dialogue that has to happen, even if it's a majority provider and a Black person, a person of color? What's the conversation that needs to happen between those two to make sure that we are getting to the right place? What do we want to encourage our healthcare providers who may or may not be from that same community? What do they need to do in those interactions with their patients?
Does anybody want to respond? Well, I would say, talking with, because the medical practitioners have been asking us those questions, and Shatira, I see you have a comment as well. But again, it's just, just having that dialogue, being more social than being technical. The physicians a lot of times say they only have 10 minutes per patient. So we're talking about, okay, physician, if you only have 10 minutes, can your nurse have these, conversations maybe about, their environment, some of their, social behaviors? Are they understanding what the doctors have just said? It's just doing that deeper dive and inquiry, and then actually listening and just, working with the patient based on where they're at. A bottom line is let's address this issue from where you're at. And I think that the patients would really start, appreciating, and they want someone that cares, that actually genuinely cares, about their health and maybe the struggles that they may be going through.
Ms. Smith, I think you wanted to weigh in on that.
I agree with you.
Yeah. Mm-hmm.
Yes, I did. Thank you very much. And I agree with you that there are instances where doctors have been known to brush off a patient's feelings of what they're going through. It's happened to me several times where, my words meant nothing and it all amounted to my blood work's okay. So it's all a mental issue, right? So if they don't see it, they don't believe you. If the pain is there, but it's not in the blood work, then we're dismissed. And there's a lot of times when that happens in the Black community. My mother just recently went to the doctor and she's having Alzheimer's issues. And rather than giving the medicine to assist her to maintain the memory, which she could have written the prescription for immediately, she sent her to a stroke doctor, and that then pushed back the medication that she so desperately needed, even though she did not want anything from the stroke doctor, and she had made that decision prior to the doctor. Doctor didn't care, made the appointment, which meant that we had to wait 3 more months for medication that we knew we needed right then. In my situation, I have long haulers disorder from COVID-19. I unfortunately am recovering from COVID-19 every day with neuropathy in, my left leg and drop foot in the right leg. So therefore, I have to wear a prosthetic now so that my leg doesn't, give out on me in the middle of a workday. Mind you, it took me 6 months to get to a neurologist to agree with me. It took me additional, 3 more months to get physical therapy. And so when we have doctors or nurse practitioners that have certain biases, they need to be checked right at the door, and they need to recognize that this is pervasive in the Black community, and it needs to be educated overall in the entire system of healthcare professionals.
Yeah, Shatria, this is Dr. Arnold. I really feel sorry. I'm wishing, and you're in my prayers, that you have a full recovery, because most doctors, the reason why they go into the profession, especially if you're an internist or a pediatrician or someone, that is really about, helping people. They're human as well, and they try to really keep a person wellness at heart. But I think that there is, bias, there's institutional racism, there are things that are in the background that people don't even realize, even on a subconscious level, that's going on in themselves. And they have to, come to grips with that in order to treat someone fully. And, we had this thing about prima non nocere, first do no harm. That should apply to the way you're approaching people too. And it should be, part of your insight into, cultural discrepancies and things that you may not be familiar with. And you have to learn and talk to people. And there was a Harvard study done recently where they were looking at maternal child wellness and maternal deaths. And for African American women, it's 3 times what it is for white women. And that is an astounding figure. It's actually on the increase rather than on the decrease across the nation. And so a lot of that they started talking about, and I heard one conversation about this, and what the person said, it was a Black female doctor, don't recall a name, but what she said was that you have to look at this, and what I think people have to understand is that we all automatically ascribe everything to these social determinants of health, poverty, and everything else. She said that's not the cause, and a study from Harvard actually backs it up now. It's saying it's not just because you have problems with transportation, or it has to do with institutional bias and the beliefs of the people that are treating people, and not listening to them, as was just said about going to the doctor and not being heard. So I think it's really important for people to be armed with some information and education, and to go into the provider's office and say, look, this is what's happening. And I'm going to tell you, this is what's happening. Now I can go to another provider, or you can listen to me. And if you don't listen to me, then I'm going to tell everyone else not to go to you too. Because you need to have someone you're going to that you can trust, and is going to actually listen to everything you're saying.
Wow, Dr. Arnold, that was really powerful. And I think that does take us, down a slightly different path in terms of thinking about, the patient, as like a consumer that has options. And that if you are with a provider and you don't feel that you're getting your questions answered, if you don't feel that whether it's the doctor or the nurse after the encounter, making sure that everything was explained appropriately, that you understood what was shared, that you shouldn't have to just keep coming for these visits with the same provider from whom you're not getting your needs, and you're not getting the care that you're expecting. And what options you have, and the ability to switch providers. That may be another conversation that we have to have in the community, to empower people to say, don't go to a healthcare team that's not serving your healthcare needs. If you can't get your questions asked or answered, and you can't get the services or the explanations that you're looking for, maybe that's not the right place for you, because then when it comes to a critical matter where, you know, you need to trust the person and believe the advice they're giving, you know, if you can't, then there may be a situation where they're telling you the right thing and you just, that trust is not there. So that might be a bigger conversation that we need to have with people about how to, you know, you wouldn't go to a store, go back to a restaurant where the food took 3 hours to come and it was cold and it was nasty. You wouldn't go back. And so if you're having that kind of a negative experience with the healthcare provider, you know, we also need to be thinking about telling people we need to find you a better provider.
Yeah, can I go back to something you mentioned earlier, Dr. Ezike, because I think it's really important. And we were talking about, we know we need more Black providers, people of color providing healthcare. And right now we don't have that. So the question, this is an emergency pandemic situation. So how do we deal with what we have right now? And I think what you're hitting on is actually where we should be hitting, is that this is a consumer environment. If you can't provide what you're supposed to provide as a provider, then I need to go elsewhere. I have a niece that actually went to a hospital and they said, oh, you must have COVID because she had a really severe headache, worst headache in her life. And they were about to just, you know, sort of pass over. And thank goodness it was a African-American doctor. And he said, you know, this doesn't fit the picture really. And he got an MRI scan. They were like, why are you getting an MRI scan? Turns out she had an aneurysm that was rupturing. And they, they sent her to Christ Hospital emergency basis. That saved her life. Because if she had just gone home, she wouldn't be here today. And she's a young lady, and they just like, oh, this is just a headache, don't worry. So it is really critical that people, you know, make sure people hear them. And we've been hearing stories about people being sent home, you know, 2 times, 3 times, and then all of a sudden they end up on a ventilator. And, you know, so we really have to take into account that we are where we are, and we have got to stand up for things. And maybe it's, you know, African-American physicians, nurses, x-ray techs, and EMTs saying, look, you better listen. And, you know, this sort of, you know, sound the drumbeat and say, you know, take care of people the way you're supposed to.
I wanted to add one thing. It's okay. Sorry about that. I just wanted to add to that, you know, like as you were mentioning, Dr. Arnold, like advocating is very important, and teaching people to advocate for themselves is extremely important as well. You know, as I mentioned in part 1, at one particular point in time, I was paralyzed from the waist down and on the left side of my body when I was in South Carolina. And one of the things that I noticed was that a lot of the doctors who, you know, were not, they didn't look like me or even close. They berated me with a lot of questions that they probably shouldn't have asked. You know, like I mentioned in part 1, you know, I was kind of a rough kid. You know, I played outside a lot. You know, I have like a lot of marks on my legs still from when I was a kid. So I just remember 3 doctors coming in and basically alluding to the marks on my legs being track marks or needle marks. And in that moment, like I was virtually alone. Like I wasn't there. I didn't have like a huge closeness to like my remaining family in South Carolina. So I had to learn to speak up for myself and, you know, be clear in my meaning. So it's you know, advocating is like very important. Sorry.
Very important points. Thank you so much for sharing that. That's a very poignant example of, you know, how people can try to identify something and then go down a different hole or put you in a box and then maybe miss why you're actually there because they're, you know, going down some rabbit hole, which might not even be correct. Thank you for sharing that. I want to pivot also because I think, you know, people, you know, there's so many levels to this pandemic. People have people have lost their lives. Survivors are here who are post-COVID. Like Ms. Smith said, dealing with long COVID. We have people who have lost their livelihoods, maybe their jobs or their businesses have been lost. And then there's the whole toll of what being, disconnected and socially isolated from people for so long, and some of the relationships that have been damaged. So, I mean, I just want to have us talk a little bit about, what tools should we be encouraging people to use to deal with the mental health consequences of COVID, and how should we be, encouraging people? Maybe what tools have you used to cope with this pandemic thus far, and what should we be encouraging our community to do?
I think that you all should keep doing what you've been doing. That helped me. Like I said, just a little tidbits of information, so now that I'm leaning closer to thinking about getting the vaccine, your honesty. I don't know any of you, but I feel like I can trust you, and it's so wonderful to see us in the medical field. It makes me feel much more comfortable because you understand me culturally, and that just keep doing what you're doing. Doing what you're doing.
Yeah, one of the ways I was trying to cope myself was, I was doing singing around the house, so my wife told me to shut up. So that one's out the door. I can't use that one anymore. But doing some walks, and clearing my mind, staying away from all this media stuff that sound bites, because that stuff is, after a while, it can really drag you down. Once again and again and again, hearing that stuff, and and making sure that you, when we say social, I hate the word social distancing, that term, because social is not social distancing, it's physical distancing, 6 to 8 feet. Social distancing implies abandonment, isolation, separation, and that's not what the case is. You can still reach out to people, you can still talk to them on your cell phone, you still have a connection to community that you can have, but it's also seeking out the mental health services if you need them. I know that the IDPH website has all kinds of resources and things that you can go to, to reach out to people. And of course, we don't have enough mental health professionals to begin with, but since COVID-19 started, we've had like a 50 to 60% increase in opioid deaths. And one of the communities that was hit the hardest was the African American community. And we've had suicides go up as well. People are really, on this emotional edge, but there are resources out there that you can reach out to. So, you just have to encourage people, and and we have to get rid of the stigma behind that, because the stigma can take you off the edge of a cliff, and you need to realize that this is causing me a problem. I need to talk to somebody, and and not feel like it's casting this shadow on you, because actually when I was first studying medicine, I learned that the field where the most healing occurs is actually in psychiatry. The success rates are really high. All the other things we treat diabetes for life, and we treat hypertension for life, high blood pressure, and we treat these things for life. But psychiatry is actually an answer, and they can actually help you to get out of these different social issues. So situational depression can cause you to overeat, and I've seen a little bit of that myself. So I have to push back from the chips once in a while, and to make sure I don't go down that road. But just taking care of yourself and seeking help when you really need it.
I would like to add in there was a scene that didn't make the cut for the documentary where Claron and myself shared a pretty intimate moment where I found myself a little bit teary because I experienced sort of that isolation period where, I really it was a really dark part that I was at. And, I was telling like I'm crying on the camera, and I'm like, that I look down and, snot on my face, tears running down, and my dog's between my lap. and like she's there licking my face, and I'm just like, oh, I'm so gross, but you love me. But that story, you know, and I tell it to people and I'm able to share sort of that intimate, it's just a greater connection. Like when I was sharing that piece with her, it was just like, yeah, you know, it's nice to, you know, see people and to talk to people and to hug people and exchange that energy, because it really is, it becomes sort of this isolation with just the news and the information, and it's really hard to get out of that. And I applaud everyone here for really sharing some of the tools and devices that you've used to get out of those moments as well.
Can I say something? Am I okay to say something? Okay.
If I might add, I apologize. Go right ahead. Thank you. I appreciate it. No, I understand, you know, what Dr. Arnold and Dion was talking about in regards to, I have stopped watching television 90% of my day. Part of the anxiety of watching the death toll numbers increase on a regular basis, and the apathy of others in regards to the health and care of those that are most vulnerable. The, you know, the idea that I was responsible for my mother's care in the midst of all of these new situations. I started going grocery shopping at 6 a.m. and you know, making sure everything was wiped down and no longer allowing people inside my home. But luckily for me, thankfully for me, I was able to use my poetry as an outlet. And I would love to say that writing is an excellent counsel. Writing it down, understanding what you're feeling, putting it out there in some sort of way. A lot of times in the Black community, they tell you not to talk about it, but to pray about it. And that's a problem that we have in dealing with our internal struggles, that sometimes we need the community to, you know, shore us up, to let us know that we're not insane because we're going through things and we're having feelings. And currently, right now, it's not a secret. It's not a family secret to have COVID, but there are so many people that are afraid to tell you that they have not been vaccinated, and that puts a lot of people in great danger. So write it down, document your feelings, keep a daily dialogue, because you're going to grow from this. You're going to transition from these feelings that are momentarily happening. You don't live in that feeling. That is not who you are, but it is how you're feeling at that moment. But just know you don't live there. And then you have a future in back to your positive self, back to your strength, and back to things that you know that you can do. And your writing will give you that. You have a spirit inside of you that will give you the strength and the courage that you need. And unfortunately, the television shows don't give you that. But I know inside of you, you have that. So use your writing, use your spirit, lean upon yourself, you know, because you are smarter than you think you are. But definitely talk to your doctor, talk to your loved ones, support them, and just let them know you're listening. But write it down, definitely. I stand in support of using that as counsel.
Ms. Smith, that was profound. And, you know, so we heard all these different ways that you can address some of the mental health challenges. Dr. Arnold talked about singing. You can do that if your spouse or your significant other is cool with that. And, you know, there's singing, there's journaling, just putting your thoughts to paper, whatever it is that gives you strength. And that might be different things for different people. Some people really like working out. Some people like prayer and meditation. But I really appreciate, you know, find what gives you strength and go to that activity or that place and take care of yourself. And again, remembering that it's physical distancing, not social distancing. You can still connect with people by FaceTime. You know, you can be spaced out safely outside if you want to connect with somebody and see somebody. There are ways that you can see people, you know, safely. So thank you so much for that. I want to thank all of you for really being so open, like sharing, you know, your stories, being candid about things you've experienced, maybe at the hands of healthcare providers, what you've dealt with and what you've had to carry with your loved ones, where you are on your vaccine journey, you know, issues that have come up. I really want to thank you for being so open. That transparency helps us all because as much as our stories are unique, we know that there are other people who are in that same boat. There are other people who have difficulty, you know, trusting healthcare providers, trusting what their doctors will say, because maybe they've been done wrong, done dirty before. So I thank you for all that you shared here, and thank you for the time, and just want people to continue to seek out truth, continue to seek out credible sources. You can't think that the person who you can't trust to ever show up on time for anything, watch your kid when you've asked them to watch your kid, who will take your car and bring it out without any gas. Now they're your source for all medical information. Okay, like, you know, we have to think about where we're getting our information from, who is appropriately licensed and credentialed to be giving you that advice, you know, and check where they got it from so that we can actually make sure we're being guided by people who should be guiding us. And so that, I think, is one of the important lessons. And I hope that is something that people will take with them as they guard their bodies and their hearts through this most challenging time in our history.
Yeah, Dr. Ezike, can I add one quick thing? You know, behind me, those are my paintings. So I, you know, I'm an artist. That's one of my passions, my loves, right? And so I've been doing a little bit of painting while this has been going on. And what I think is that it really goes to the heart of what you were saying. People have to see past the pandemic in the sense of surviving it. That you have a future life. So you can be doing things to plan, you know, I'm going to open a business, I'm going to go to school, I'm going to do this. That doesn't stop your life. This doesn't stop your life. But what you want to do is make sure you do everything you can to make sure you can do what you want to do later, that you're going to be in good health. And the best way to do that is to get vaccinated, to protect yourself. Is putting the armor on. You know, I was a soldier, and Dr. Ezike actually was in a conference with her. We talked on with this thing about, you know, the health, and we were talking about wearing a mask. And when I was overseas in combat in Iraq and, you know, other places, I ended up having to wear 40 pounds of body armor. And people are complaining about wearing a 4-ounce mask, and I look at them and go like, what? You know, it is, you know, you have to protect yourself, make sure you're wearing a mask, and make sure you get vaccinated. And that's what it really comes down to. And it's because we love you. It's not because we're, you know, trying to push this science off on people and you know, this company thing or the company set motto or saying, but it's because we want to see you do well and live out your dreams and visions and creativity.
Well said, Dr. Arnold. I mean, this is such a beautiful panel. I mean, so many beautiful people, beautiful experiences, so much knowledge, wealth in that knowledge, such great energy. I mean, we can go on, and I would love to have this discussion again if we can come here and have this discussion next month and see where we're at then, because the world is changing. But as Dr. Arnold said, we have to see ourselves past this pandemic. We have to tap into our strengths, as Shatria mentioned. And I just want to thank all of you for sharing some of your time, your space, your energy, your knowledge, being vulnerable, being transparent. I'm hearing those words, and I love that. You know, that's what I do here with Hopeful and Victory. I approach things with visibility that leads me to transparency and ultimately vulnerability, so that we can have a discussion that's going to destigmatize certain things that just shouldn't exist. And with that being said, with everyone, as always, stay hopeful in victory, and we will see you again in the future.
And
Take
listen
care.
to Dr. Ezike. She's the real thing.
Yes. Goodbye, everyone. Have a great night.